Hello, everyone. Welcome to the Testing Psychologist podcast, the podcast where we talk all about the business and practice of psychological and neuropsychological assessment. I'm your host, Dr. Jeremy Sharp, licensed psychologist, group practice owner, and private practice coach.
This podcast is brought to you by PAR. Check It, available on PARI Connect, is an online library of popular mental health checklists that you can use as a personal inventory. Stop searching the web and make Check It your one-stop shop. Learn more at parinc.com/CHECKIT.
Hey, y'all. Welcome back to the Testing Psychologist podcast. Today's another episode in the Out There Assessment series. My guest today is Dr. Vicky Lomay. She is a Dinè Navajo psychologist in Arizona and focuses her clinical practice on developing and interweaving culturally appropriate methods into assessment, testing, and individual therapy. For over 2 decades, she has worked with tribal communities in the Southwest United States and maintains strong ties to her tribal homelands and traditions. The guiding principles and values of her Dinè identity continue to inform and guide her personally and professionally. Dr. Lomay co-edited the book Understanding Indigenous Perspectives, Hallucinations, Visions, and Dreams, and she co-authored chapters about multicultural neurorehabilitation and neuropsychology. She got her doctoral degree at Arizona State, her clinical internship at the Missouri Health Sciences Psychology Consortium, and her postdoc residency and fellowship in clinical neuropsychology at Barrow Neurological Institute, St. Joseph's Hospital and Medical Center in Phoenix, Arizona. So if you missed the other episodes in this series, the Out There Assessment series is meant to have short, relatively short, but hopefully meaningful conversations with psychologists and practitioners who are in relatively unique settings or those who hold relatively unique specialties. And Vicky is no exception. This was a fantastic conversation, and she's doing fabulous, meaningful work. And I enjoyed this greatly. So without further ado, let's get to my conversation with Dr. Vicky Lomay. Hey, Vicky, welcome to the podcast.
Hello, good to be here today.
Yeah, thank you for being here. I am excited to talk with you. It's been really fun to do these out there assessment episodes. And after our pre-podcast conversation, I know that we have some really cool stuff to chat about today. So thanks for being here.
Yeah, I'm glad to share.
Let's jump right into it. So tell me about your unique or unorthodox work environment or specialty.
Well, I am a clinical psychologist, and I work in I do a couple of things. One, the main thing I do is I do work for a tribal health clinic in Arizona, and our service population is all American Indians. I also have a private practice where I provide consulting, some trainings, speaking, things like that. Again, also that is mostly all to American Indian communities, or talking about working with American Indian communities.
Mm-hmm. Yes. Yeah, it really jumped out to me, one of the things that you said in our previous conversation about how few Native psychologists there are in the U.S. Can you say a little bit about that? Just how many folks like you are actually practicing?
Yes, we are very few and far between. I believe the last time we a group of us. So I'm a member of the Society of Indian Psychologists of North America. So that's a group of American Indian psychologists in the U.S. and Canada. We kind of did an informal count several years ago where, we just kind of volunteered our own information, but also people that were not like on our listserv. We're like, oh yeah, this person's a psychologist. Oh, and I know this one too. And so it definitely came out to be, I think it was less than 400 across all of North America.
Yeah. Yeah. This is, well, truly unique. That's sort of the aim of this whole podcast series.
So it is definitely a small group of psychologists and
Sure.
across and again across just the span of career. You know, we have some early career folks, and we have some of our elders who have been in the business for quite a number of years.
Sure. Yeah. Yeah. It's nice to have some of those generations, I suppose, in our profession. Yeah. Where you can learn and teach and connect on different levels. Tell me about your work in the tribal health clinics. What does that look like?
So I have worked, so this particular tribal clinic that I work currently is in an urban area in Scottsdale, Arizona. But I have worked in other similar places as well. So my experience has been working in different tribal clinics or Indian Health Service hospitals for like the last 15 years or so. So for those who may not be familiar with, tribal communities or American Indian populations, a lot of the healthcare is provided by Indian Health Service, which is a division of the Health and Human Services, so provided by the government. And the Indian Health Service, is kind of the provider of healthcare for tribal communities across the U.S. And that kind of goes back to the government to government relationships that tribes have with the U.S. government through treaties, laws, executive orders, and such. So Indian Health Service provides the majority of healthcare for tribal communities and tribal members across the nation. So there are different hospitals and clinics across the U.S. that provide this healthcare services. And some places, some tribes have chosen to, this could be like a whole nother discussion, but they've chosen to take over their own healthcare. So, they get the monies and then they run their own clinic. So the tribe that I work for now has their own health clinic, and it's not it's not under Indian Health Service. So with Indian Health Service, it's like you work for the government. You're a federal employee, and you have to go through the whole process. The bureaucracy of working for a federal entity. Which so I worked for both. Worked for Indian Health Service for a number of years, and then now I work for the tribal clinic. So my work environment here is. It is like working in a small town, actually, even though we are in Scottsdale, Arizona, which is right there in the Phoenix metro area. I mean, you could just you cross the street that divides the reservation from Scottsdale, and it's like night and day. It's like fields and empty, and then all of a sudden, completely urban area. So, so there is. So like I said, it's kind of like a small town. They have their own, police department, fire department, the administrative offices for all the tribal services and things like that. And then we have the health clinic where I work at. It is not a hospital, so it's not like 24 hours, no emergency department or anything like that, but it does provide a lot of outpatient services. So I work for the behavioral health division as a clinical psychologist. And currently I am, so the majority of my work is providing direct clinical service, psychology related. I am in the health clinic. I am the only clinical psychologist that does this. Now, my supervisor is also a clinical psychologist, but they're mainly administrator role. Sure. I'm the psychologist.
Sure. I gotcha. And where does assessment come into play in your work?
So when I first started working here, I was kind of like just a generalist psychologist. So, providing therapy, was the bulk of my work. And then over time that changed, as I was able to do more and more assessments for, our patients coming in, that over the past 8 years, this is now pretty much what I do full time now, is doing assessment. And the assessment is actually, again, kind of just like a generalist approach. It's not just, it covers quite a bit, actually. Sometimes I get referrals from primary care doctors. Sometimes I get referrals from other therapists. Sometimes I get referrals like our behavioral health consultants that work in the primary care clinic. Sometimes, like I said, it is a small community that has a lot of different services there. So sometimes I may get referrals, maybe like from adult protective services. I might get some questions from legal services, maybe even like the senior services department. So I get all kinds of questions of, patient referral questions. And the questions also are quite varied, but all have some sort of assessment component to it. So sometimes, there's, like let's say an adult comes in and they have a history of special education services, but that was like from 20 years ago. And they just want, updated documentation. Maybe they want to go back to school. They want to go back to work. They want to request accommodations, but they need documentation. So that would be, one possibility. Sometimes there are, questions about, maybe like memory with some of our elder folks, whether, that's something that needs, to be further evaluated. Sometimes, I get, people who need further evaluation, for, who have some serious mental illness, and whether, their symptoms are, how much it's interfering with their day-to-day functioning. So there may be questions maybe from other therapists about that, or how they could help. Sometimes, people do come in for, they have attention problems and they want to know what that's about. They have a hard time focusing. They want to know what that's about. Sometimes is it differential. So, and then sometimes I do get like neuropsychological type of questions, like someone had a TBI or someone was recovering from a stroke. They had an aneurysm or something like that. And they, they want to know a little bit more about how things are going for them, what I might be able to recommend for them and their families. So it's a little bit of everything.
It sounds like a little bit of it. Yeah. It sounds like you have to be a jack of all trades in some way,
Yes,
a real
basically.
lifespan psychologist. Yeah. To be able to address all these questions. I mean, would you say the way you describe it, I'm getting the impression that even though you're in an urban environment or a city environment, there's a rural component to this, and that you are the only psychologist doing assessment for this population in a big area. Am I thinking of that the right way or not?
Yes. And not only just for this community, but just in the greater Phoenix metro area. There are only a few Native psychologists in addition to myself. I think there's just very few of us, and those that are psychologists, most of them do not do assessments like I do. So
Sure.
sometimes I get referrals from even outside our clinic, because people know that I can do assessments.
Yeah. Well, it's a valuable skill, right? We do good work. Yes. Now, you talked a bit in our brainstorming conversation just about how you have to be pretty flexible, but in terms of administration and, sometimes going off script and non-standardized administrations, depending on language or other communication styles, or just individual factors. I would love for you to talk just a bit about that aspect of the work and needing to be flexible.
Sure. So sometimes in other places that I've worked, and even now, as a part of my, I do consulting also in a private practice that I've had for about 12 years now.
Mm-hmm.
That's more of a smaller part of my day-to-day work, but I do sometimes get requests from other agencies, other organizations outside of the one that I work for, to do different types of assessments. And it does take flexibility, most definitely. Like I said, I mainly work with adults, so over 16, usually over 18, all the way, to elder status, like I think into the mid 80s and stuff like that. And with American Indian communities and tribal communities, I think having for me is having a good understanding of the population that I'm working with, because there is definitely a range of there can be a range of language differences. There are some communities that they still speak their tribal language. There are still some older folks who still prefer to speak their tribal language rather than English. And again, education, formal education can vary. Exposure to, English can vary. So taking that into consideration, sometimes the most common assessments that we psychologists may be used to may not be appropriate for certain people. Also, like for example, when I worked for one of the other clinics, there was a majority of our population, or I guess some of my referrals, which were for elderly folks, and most of them were bilingual or preferred to speak their native language. So as far as like doing memory testing, I couldn't use any of our most commonly used assessments. So that was where it was kind of like I couldn't use any standardized instruments, just had to, again, kind of clinical interview, speaking with family, and then also kind of just like home brewing my own my own kind of assessments for memory, just for a quick, kind of like cognitive screen type of thing. So, definitely having to work in with a challenging environment like that is not unusual for me. I shall say that. It happens more often than not.
Yeah. I mean, I think so many of us are, try to stay pretty bound to standardized assessment. Can you comment on that process of getting more comfortable with non-standardized assessment? Like, what was that like for you? If you can remember?
Let's take a break to hear from a featured partner. I'd like to tell you about a real time saver. Check It is a library of popular mental health checklists hosted on PARI Connect, the online assessment industry's most reliable platform, that you can use as a personalized inventory. No need to search around or purchase from multiple websites. Check It is a flexible one-stop shop, safeguarded in a HIPAA-compliant platform. Learn more at parinc.com/CHECKIT. All right, let's get back to the podcast.
For example, like as far as memory, so in speaking with them, again, kind of getting a sense of, what I would do, for anybody else, how well are they, following the conversation? How well, are they following my questions, or, how are they answering, so on and so forth. So more of like a clinical diagnostic interview. And then as far as like doing kind of my own versions of like memory, there was one, you just showed the pictures of animals, and then just saying, asking them, one is to identify the animal, and then, just asking them to remember them. And then later, after I had talked with them again, did some other things, say, hey, those animals that I showed you earlier, tell me as many of those as you can remember.
Mm-hmm.
So yeah, like I said, trying to just do the best I can with what I have.
Sure.
So that's one example of where, like I said, obviously it's not standardized. There's no normative data, but again, just kind of giving me a quick sense of where they're at with, retention, recall.
Absolutely. What are some of the unique challenges that you think, this population may work with or run into?
There's actually quite a few. And I think, again, it depends on which tribal community that you are working with. Here in Arizona, we have well over, I think, 22, 24, I can't remember offhand, tribal communities, tribal reservations here in the state. So, and I think a quarter of our state is tribal lands. So the likelihood in Arizona of working with, a Native American is pretty high. And each community is also different. So like I said, the community that I work for currently is fairly urban. I mean, you just drive, a couple miles away and you're in downtown Scottsdale, or, Arizona State University is like literally across the river. So you could be somewhere very, urban very quickly. Whereas in other places, like where I grew up on the Navajo reservation in northern Arizona. It takes 6 hours to drive across, and is like roughly, usually it's usually compared to the size of West Virginia. And some parts of the reservation are very, very rural, meaning, so right now, as we're recording this, I'm actually at my family home here on the reservation. And the highway is about 4 miles away, and it's a dirt road to get here to where I'm talking to you now.
Sure. Oh my gosh. Yes.
So each tribal community, some of them are very rural, some of them are very urban. So that in itself can be, can present some challenges. The other challenges that I often see because of those factors can be access to healthcare. So where I am, like literally right now, the nearest Indian Health Service hospital with an emergency department is 70 miles away. So we do have like a day clinic, an outpatient clinic, which is closer, but from where I'm at right now, it's still about, 15 miles away. So, and then, we have the regular city emergency department. There's a border town not far away from where I am right now. So, they have a hospital there and such. But again, so transportation can be an issue. Even things like access to internet or, electricity, water, stuff like that can definitely present some challenges.
Right.
And those are definitely some things that I take into consideration. Once I learn more about the person that I'm doing an assessment for, is, kind of getting a sense of, where they live, what resources that they have, because that can also inform what recommendations that I might give to them and their family. Telling them to, here are some websites, or you can look up, and, if they don't have internet, then that's kind of like useless.
Sure. Yeah. I think providing actually helpful recommendations is one of the hardest and most crucial parts of our job. Like, it's really easy to just do a shotgun approach and, see what sticks. But it's even more important with folks who may not have access to many resources, right? In rural environments or elsewhere.
Yeah, exactly. So I think, for working with this population, that's one, definitely one important part, of the work is, finding out more about the community or the people that you're working with. And then again, in that individual, data gathering of finding out, more about what resources that they do have available to them, where they live, and, really gathering a lot of that information to help inform the recommendations that you might provide for them.
Yeah. Well, let's switch gears a little bit. I would love to just hear maybe quickly, like how you ended up in this work environment. Was this a purposeful career choice for you? Was it something that kind of fell in your lap more by circumstance or what?
I would say purposefully by accident, if that makes sense.
I love it.
So when I was in graduate school and completing my doctoral program for psychology, I was a counseling psychology, and I always knew that I would work for a tribal community or working with, American Indian folks. I always knew that was my goal.
Mm-hmm.
Where I would do it and how I would do it, not so much. So I always knew that I would be working somewhere with a tribal community. Huh. The assessment part was where the kind of like the by accident came through, is because when I was in my graduate program, that was not something that I thought about pursuing. We had our basic, psychological assessment course and stuff like that, and that was about it. But when I got into my internship year, that's when I really became interested in assessment, because my internship was neuro rehab focused, health psychology focused. Worked in a lot of hospital settings for my internship, and where assessment and testing was a part of that. And I did, rotation in neuropsychology. So that's where I really became interested in assessments. So I kind of did that in a roundabout way. And then when I did my postdoc, that was completely all clinical neuropsychology.
Cool. Yeah.
So yeah.
Yeah. Yeah. I feel like that's the story for a lot of us, at least for me too. I kind of had an idea of what I thought I wanted to do, and then opportunities present themselves, and then take a different path, and then you integrate, and then, yeah.
Yeah. And right now so after I finished my postdoc and I started working for Indian Health Service, assessment and testing is just in the places that I've worked with, was not something that was usually offered. And again, I think it comes back to the clinical experience of the psychologists working there. Some of them, and again, as we probably know, some people don't like to do assessments. We all have the basic training in it, but some people just choose, I don't want to do this. I'd rather refer to someone else. And then also sometimes the clinical need in some of these tribal communities also informs, what services can be provided. So a lot of it is, trying to get people in just to access individual therapy or counseling or other services to kind of help them with, from more of like a mental health, behavioral health perspective of, being able to provide those services. So testing and assessment seemed kind of like an extra special type of service, which, in prioritizing what health needs could be met, usually it was more towards the more like counseling type of stuff. So with assessment and testing, knowing that I could provide that, I definitely did start to do that in the different places that I've worked. So it was definitely a welcome addition to the services that they could provide, because it was something that actually couldn't be, for a lot of folks, they wouldn't be able to get that kind of service anywhere. And the longer that I do it, and especially where I am now, I'm beginning to see how difficult it is for, a certain population just to get, a basic, testing assessment service. It's really difficult. So being able to provide that service, I feel like, is definitely something I really enjoy doing, because I'm providing something that they would not feel, otherwise not be able to get. And especially with the population too, a lot of them are like on public health insurance. So sometimes even those are limited in like what kind of specialty services that can be provided. So sometimes, again, kind of like hierarchy of prioritizing what their health needs are. And sometimes testing or assessment is at the bottom. There's other health needs that need to be met.
Yes.
And those are kind of like the priority of, okay, let's go down the list of, what we can recommend. And testing would be nice, but, we can't do that or we can't provide that. So for me to be able to do that for some of the patients that come through our clinic, I think is really helpful for them.
Yes. Well, you're touching on this, but I would love to hear, the aspects of this work that you really love, that you really enjoy.
Part of the one thing I really love about it, like I said, is just being able to provide a service that this certain communities would not otherwise be able to get. And also, I think being for some of my patients, like I said, the population is all, American Indian tribal folks. And I think the other part of that is for them to also be able to get the service from someone who looks like them. So knowing that, there's a native psychologist here that is providing the service. And then in some of the other communities where I've worked, like I said, I grew up on the Navajo reservation. I speak the language, not fluently, but I understand it much better than I can speak it. So sometimes for patients to be able to switch over to Navajo and start to tell me things and knowing that I understand what they're saying is really valuable, not only to them having this experience, like, oh, this person understands me, this healthcare provider understands exactly what I'm saying. And sometimes some patients will switch back and forth between English and Navajo, again, knowing that I can understand what they're saying. So I think, that's another part of this that I really love is, like I said, being able to provide a much needed service in a culturally sensitive and I guess culturally competent way. That
sounds incredible. I'm certainly not an expert on working with this population at all. And I can only imagine that the value of feeling seen and feeling connected to a clinician who looks like them, that's
exactly
so important for many of us, right? Any things that you don't love about this work?
I think some of the things I had touched upon earlier of just that there's some lack of resources, and being able to, and some things are just beyond my control. I don't have control over certain things like like infrastructure or transportation needs, or sometimes it's frustrating to try to work around those as best as I can. So I think that's the main thing. And then I think also just sometimes the I guess the underfunding of services, because like I said, the majority of it is provided through Indian Health Service. So again, I think that also varies from community to community, of what the tribal, what services are available. So again, that varies very much from community to community. So every tribe is different in what they have, again, access to resources, what services that they can provide to their tribal members. So wherever you're working, again, like I said, having some understanding of what is available and what just having some knowledge about the community definitely goes a long way.
Absolutely. What would you recommend for folks if there are people listening who want to get into this area of practice? Any resources, any career paths, any choices, anything that may support folks in going this direction?
So I'm going to divide that into like 3 separate answers.
Great.
One is if it depends on if they are a tribal member of a tribal community or not. If they are, if there's someone out there listening who's native and like, wow, this sounds really interesting, I really want to learn more about this. Kind of breaking that down also into, are they a student or are they currently a professional? if they are a student and looking to learn more, there are some programs at some different universities in the U.S. that specialize in working with American Indian students who want to go into psychology. So there's specific programs. There's a couple of universities that have like mentorship programs and kind of mentor students through a graduate degree in psychology.
That's great.
So there's that if the person was a student and interested in this field.
Sure. Do you know those programs off the top of your head? Even just
I know there's one at University of North Dakota. I think Oklahoma State had one, and I know University of Utah has another program. And I know there's another. I think I know Bemidji State in Minnesota has a program, but I think that might be a bachelor's program. The other ones are graduate school programs, and I think there's a few more. So if a person was interested and they are a tribal member, if they're a student, those are some options. If they are professional, if they are not already a part of the Society of Indian Psychologists in North America, that would be an organization to join or get more information from. There is a website. There's an annual meeting, conference. We have a listserv, very active. So a lot of information there for folks that are either Native psychologists themselves or who work in a tribal community and they are a psychologist. So you can join a listserv even though if you know, or get some information and consultation for that. So if a person is not Native, not a tribal member, but they're interested in this, I think definitely doing what you can to learn, and seeking out resources of things like Society of Indian Psychologists, or speaking with other psychologists like myself, of finding out more information on what could be helpful. Because I think if a non-Native comes into a community like this, there can be some layers there that need to be worked through, and being able to do it in a culturally appropriate way. So, those would be my recommendations.
Yeah, that's fantastic. I'm guessing there's at least a few folks out there who are listening and would love to find their way into this kind of work. So super helpful. Yeah. And we'll list all those resources in the show notes, of course, like usual. So I really appreciate this. I think this is a good point to wrap up, but I am grateful to you for just diving into it and sharing a little bit about this work that you do. It's incredibly important for the folks you work with and pretty unique. There aren't a whole lot of people doing this kind of work, right? So thank you. Thank you for being here.
I certainly appreciate it. And thank you for having me.
All right, y'all. Thank you so much for tuning into this episode. Always grateful to have you here. I hope that you take away some information that you can implement in your practice and in your life. Any resources that we mentioned during the episode will be listed in the show notes, so make sure to check those out. If you like what you hear on the podcast, I would be so grateful if you left a review on iTunes or Spotify or wherever you listen to your podcasts. And if you're a practice owner or aspiring practice owner, I'd invite you to check out the Testing Psychologist mastermind groups. I have mastermind groups at every stage of practice development: beginner, intermediate, and advanced. We have homework, we have accountability, we have support, we have resources. These groups are amazing. We do a lot of work and a lot of connecting. If that sounds interesting to you, you can check out the details at thetestingpsychologist.com/consulting. You can sign up for a pre-group phone call and we will chat and figure out if a group could be a good fit for you. Thanks so much.
The information contained in this podcast and on the Testing Psychologist website are intended for informational and educational purposes only. Nothing in this podcast or on the website is intended to be a substitute for professional psychological, psychiatric, or medical advice, diagnosis, or treatment. Please note that no doctor-patient relationship is formed here, and similarly, no supervisory or consultative relationship is formed between the host or guests of this podcast and listeners of this podcast. If you need the qualified advice of any mental health practitioner or medical provider, please seek one in your area. Similarly, if you need supervision on clinical matters, please find a supervisor with an expertise that fits your needs.